people of color want an informed ally who's done their own work, really gain a deeper understanding so that you aren't then going out into the communities of color and unconsciously causing more harm than good.
Welcome to Women We Should Know with international speaker, mindset reset mentor, author, and your host, Leslie Michaels. With audacious honesty and candor, the Women We Should Know podcast presents the wisdom and life-empowering insights of women who are the embodiments of innovation and social evolution. Please join Leslie as she shares potent conversations that will inspire your personal and professional evolutions.
Hi, welcome to Women We Should Know, and this is Leslie with you again. For those of you who have been tuning in, you already know, and for those of you new to the show, welcome, welcome. We are focused every week on bringing to you the voices of women who are doing dramatic things in the world. They're uplifting people, educating people, emancipating people. And it is my privilege each week to be able to bring those voices to you so that you can be inspired and so that you can make the next big step in your journey in life. Today, I am indeed honored to have with us Dr. Carolyn Coker-Ross. She is an author, speaker, and expert in using integrative medicine for the treatment of food and body image issues and addiction. Say that fast 3 times. Dr. Ross is the CEO of the Anchor program, an online program for binge eating, emotional eating, and food addiction. She is a board-certified physician in preventive medicine and addiction medicine and is a graduate of Dr. Andrew Weil's Fellowship in Integrative Medicine. I'm a big fan of his. Dr. Ross is also a co-founder of the Institute for Antiracism and Equity, which works with mental health, eating disorder, and addiction treatment centers to develop and provide equitable and unbiased, culturally competent care and increase access to treatment to Black, Indigenous, and other people of color. Welcome to Women We Should Know, Carolyn.
Thank you, Leslie. It's a pleasure to be here.
And a pleasure to be with you. One thing I noticed as I was going over your bio that it didn't mention that I want to jump right in and speak about or invite you to speak to, and that is the effects of historical and intergenerational trauma. I know you are a great expert in this, and why is it important to understand the effects of this? Could you speak to that for our audience?
Yeah, that's a big topic. As you know, you and I met when I was preparing to do my TEDx talk on intergenerational historical trauma, which I did in January of this year. And there's a couple of angles you can go at it with. One is certainly for people with addictions, eating disorder, people with food and body image issues, it's very important to understand the impact of trauma and how it can increase your risk for having those conditions. So many people wonder, like, what's wrong with me? Nothing happened to me in my life. I've had good parents, et cetera, and yet I have, a drug or alcohol problem. And so when you're looking at that question, what's wrong with me? It really is a question that harks back to the old days when we always thought that, during the temperance movement, when alcohol use disorder was described more as a moral failing, a weakness that people have. When in point of fact, we now know from numerous studies that eating disorders and addictions are actually have some genetic component, and they also, they are considered diseases or disorders. So I think to be able to address that shift, part of the issue is really acknowledging that addictions and eating disorders have their roots in trauma. So when we just, define trauma as loss of a sense of trust, a sense of safety and vitality, then we know that, as per the Adverse Childhood Experiences study, that those kinds of traumas, whether it be sexual abuse, physical or emotional abuse, neglect, as well as household dysfunction issues, can increase one's risk for addictions and for over 40 medical conditions. But now I'm
Over
getting to
40.
over 40, including
My
cancer,
goodness.
lung disease, heart disease, all, just so many. So it's more than you think. And the Adverse Childhood Experiences study was the first to make that link between something happens to you in childhood, and then when you're an adult, suddenly you have these conditions like addictions or eating disorders. And so it's pretty clear now that that link is there.
Mm-hmm.
And what the Center for Disease Control is now looking at is the historical and intergenerational trauma link. So what does that all mean? Well, historical trauma is what we're seeing play out in the social unrest today,
Mm-hmm.
where
Mm-hmm.
people like myself, who are descendants of slaves, as well as Indigenous people, who experienced all of whom experienced extreme traumatic events that affected whole populations. So that's different than individual trauma where something happened to me. This is something happened to a group of people based on their race, their ethnicity, their religion, as we can see from the Holocaust. So historical trauma affects people in that particular group. And then the effects of that trauma are passed down to children and grandchildren. That can also be considered intergenerational trauma. But even if you aren't part of a group that had experienced historical trauma, the effects of trauma, say, for example, your father had alcohol use disorder, and he was maybe even violent because of that. And then that affects you. And then those effects then are passed down from you to your children and their children. So that's what we're really learning now. And the research is so exciting, Leslie, in this area, because we're now being able to explain how this happens. In the past, it was all about, well, maybe it's how these people who've been traumatized parent. And that probably is part of it. But we're also recognizing now that even though trauma does not change the DNA, it does change the expression of genes. So that a gene, say, for addiction or a gene for depression or for heart disease can be turned on by trauma. And then that change in expression is what's passed on to the next generation and the next generation. You're kind of a science nerd, so I just think that's super exciting.
Absolutely. And I actually am in the middle of studying gene science and neuroscience, and this turning on and turning off of gene expression. It's something I really am reading a lot about, but I don't comprehend it yet. And maybe some of the listeners in our audience don't comprehend exactly what that means and how that works. Could you explain that to us a little bit, Carolyn?
Sure. I mean, I think the simplest version of epigenetic changes, which is what I was talking about, is what I just said, that something happens and then whatever happens causes a gene to be turned on. And so that's when the risk gets increased, and then that change in the gene is passed on to the generations.
What does it mean when a gene gets turned on? What happens? Is that like turning on a light switch, or is that like plugging into an outlet that has a short wire, or what is that?
Let me just give you a little bit more background. We know that in offspring of Holocaust survivors and some other people who've had historical trauma, that there's a change in some of the genes that code for how we handle stress. So these changes in the genes on this, it's a biochemical change So it's a change in methylation on the stress gene that then codes for us to either, if it's passed down from the father, it codes for higher risk for depression, anxiety. And if it comes down from the mother, it codes for hyperactivity in your stress response. So just imagine if you have a parent who is always on red alert because they're a survivor of the Holocaust, and maybe they also don't deal with their emotions very well, which we call psychic numbing. So that their gene, which codes for how they deal with stress, has caused those effects. It's turned on their stress response in a way, it's hyped it up. And that lasts throughout their lifetime. And then it has an impact on you. So as a child of a parent with post-traumatic stress disorder, for example, if your parent experiences what we call psychic numbing, they don't express emotions, then you may feel that as emotional abuse or emotional neglect. And that is one of the things that is considered an adverse childhood experience that, again, then increases your risk for these 40 conditions.
That is all fascinating. And the one thing that I'm going to pull out of that I think is particularly fascinating is the way in which it manifests differently if it comes down through the paternal line, whereas if it comes down through the maternal line.
Yeah, one of the studies that's really, really old goes back to Union soldiers in the Civil War. And those soldiers who had been captured and were prisoners of war, their offspring, their sons particularly, had, changes in their lifespan. And yet, if the mother, while she was carrying the son, was very well nourished, it could actually guard against that effect. And so, it's an evolving science, but we've been seeing these effects for decades. We just didn't know how to explain them until now animal studies and human studies are showing. I think one of the coolest ones is the animal study that came out a year ago, little mice who were taught to be adverse to the smell of cherries. And they were taught that because every time they exposed them to the smell of cherries, they gave them a little electric shock. Okay, then those mice have mice babies. The mice babies didn't get any electric shocks, yet and still, when they were exposed to the smell of cherries, they had the same reaction. And then their children also. So for 3 generations, 2 generations after the original trauma of the electric shock, that effect was carried forward for 2 more generations.
That is fascinating. And I'm so glad you brought forward that example because it's a simple example that we can all understand. Mice, cherries, electric shock. That's a wonderful example. Yeah. Well, this brings up another question in my mind. I'm a questioning kind of person. Trauma can take on so many faces. For instance, would this be relative to someone whose grandfather was maybe exceedingly wealthy and then lost everything in the Great Crash?
Well, you certainly could consider that traumatic. I think it depends on the actual effects that occur as a result of the Great Crash. Like if someone then became impoverished, had to move into different housing, go to different schools, all of that kind of stuff. Yeah, that could have a traumatic impact that could then be passed on to future generations. But a lot of it also has to do with how someone responds to a traumatic event. So there are people who just naturally have more resilience. And so say they go through the crash, and even if their circumstances are changed, they may be able to, ride through it, get wealthy again, or just deal with it. Where other people may start drinking or be depressed, etc. So a lot of it does have to do with our reaction and our response to trauma.
Right. I actually was what provoked that question was thinking of a friend, and that friend's grandfather threw himself off of a New York high-rise. It was just too much to take. And of course, it changed everything in the family for every generation after.
Well, certainly suicides have long-lasting traumatic effects in a family. So it wouldn't necessarily be, I mean, the crash on Wall Street was the cause of the suicide, but
Right.
the suicide is really the traumatic event more than anything else. Suicide has a dramatic impact in families, and that can go on and on through generations. So
that's a great clarification. Thank you for that. So I know you work with a lot of people, and you work with organizations, and you just work everywhere. You're working all the time to help to develop approaches and to help to develop, I don't know what all you're developing, but you are developing a lot of templates, let's say, to help a lot of people. How do you help people heal from historical and intergenerational trauma, and how does it change their lives?
yeah, I think on an individual level, just understanding historical trauma gives people a sense of peace and agency around that kind of trauma. I mean, historical trauma is not something that you can even heal from on your own. It's a systemic issue. When you think about Native Americans, for example, many of them have left the reservation. Many of them have lost their cultural connections because of being sent to boarding schools, being, forced really to go to boarding schools where they were not allowed to have contact with their families. And so you can, a person can do only so much healing without then helping a community heal. And I think that's what you're seeing in the news now, is this really reaction that communities have not been allowed to heal because of ongoing racial and ethnic oppression, systemic racism, and the effects of historical trauma. So you can do only so much to heal as an individual when you're continuing to be in an oppressed society. And that has its own effects on you on a day-to-day basis, like the effect of being a mother of Black sons, and how, in Colorado, I'm sorry, I can't think of his name right now. I felt so upset to learn that this beautiful young man who went to get a tea for his brother was gunned down by the police. So there you are, mother, sitting at home waiting for your son to come back from the grocery store, and he never returns. And that's the kind of thing that Black women who have children, particularly sons, have had fear for their entire lives, or the entire lives since they've had children. And I think anyone listening who is a Black woman who has children knows that fear, and knows that it's very difficult to control that situation, to keep it from happening. And so I think it's really important for all of us, particularly in America, to recognize that this isn't a Black problem. It's not a Native American or Indigenous problem. It's not a Latinx problem. It's a problem for white people as well, because in a society where people are oppressed, the society can never fully prosper either. The emotional capital, the psychological capital, all of that is missing, in the same way that it was missing before women had the right to vote and women had the right to participate more fully in society, and even now where women have the glass ceiling. But that's even, magnified for people of color. I think the number is something like, for every dollar that a white person makes, it's 72% for someone from the Latinx population, and it's maybe 50 some odd percent. I may have the numbers off, but it's startlingly low. And beyond just salaries is, even more importantly, the wealth gap. Where for every dollar of wealth, meaning, like say you go through a recession, you have money to fall back on if you're a Trump or a Rockefeller or, fill in the blank. Whereas for people of color, there's nothing to fall back on. So you're one paycheck away, or, a couple of months away from losing your home or losing your livelihood. And that, that keeps the cycle going over and over.
Right. Well, everything has to change. And it's been too long coming. And you and I both know, I think everyone, whatever side of the street they're on, whether they're working into social advocacy or health or not, understand it's going to take more than a minute. So what can be done to help? And I'm sure you're doing whatever it is every day. What is it that could be done to help with this historical and intergenerational trauma while we are coming to our senses and starting to treat everyone with humanity?
Yeah, I think what needs to be, you're right. I'm doing all that I can do.
Right.
But what I'm doing is not something that you would be doing. So
Right.
I think for everyone, educating yourself and doing your own work is the most important thing. I
Right.
love Robin DiAngelo's work, where she talks a lot about white fragility and how so many progressive people, white people, feel that they don't have to do anything. They marched during the 60s, or they've contributed to some cause or something. But if you don't do your own work and recognize that all of us have biases, I mean, no matter what your color is, you've got biases. But if you live in a society that's dominated by white people, then we know that white individuals have implicit bias that they don't even recognize or acknowledge. And so the very, very first step is really becoming aware of your own biases. These are like water to the fish. We're all swimming in this same culture that oppresses Black people and people of color. And so you can't be swimming in that pond and not pick up some of the bias. And so I think the most important thing that anyone can do, if they really, there's a lot of talk about being Black Lives Matter allies, or allies to LGBTQ communities and so on. I think what people of color want is an informed ally who's done their own work. Like, read Robin DiAngelo's book, look into Ibram X. Kendi's book, How to Be an Anti-Racist. There's, they've been on the bestseller list now since the killing of George Floyd. And those are books that will help you really gain a deeper understanding, so that you aren't then going out into the communities of color and unconsciously causing more harm than good.
Absolutely. Absolutely. I have those books. As we do move forward, and as we hopefully see more and more people taking personal responsibility, one thing I would invite our listeners to do is just notice when white privilege is extended to you in a way that maybe it has been a million times and you didn't notice before.
Yeah.
Start paying more attention. But as we move forward and we all begin to become more conscious, what is the one thing you would most like to see in the immediate, in the next, let's say 12 months?
I'm not sure I have enough hope in American society to have any goals. Remember, I'm old enough to have gone through the civil rights movement. I was actually born into the Jim Crow South. So I've seen a lot of promises come and go, not too different from what Native Americans have gone through, where there have
That's
been
right.
contracts with the US government that have been just, willy-nilly violated. So, I'd like to see people, white Americans step up to the plate and take on this cause in the same way that Black Americans and people of color have had to do. I mean, I think in the cultures of color, there's an exhaustion about talking about this, about trying to educate people, about being approached by their white friends to ask, what can I do to help, and all of this. It's really, again, you've got to take up the mantle. And I see some of that happening with younger Americans, the millennial generation. But the question is, how far are you willing to go? We're only 3 or 4 months into this process. And if it's like it's been before, then we'll have, a couple of little things will happen and everybody will go back to their jobs and, think, oh, we've already taken care of all that. That's not a big deal. So, I think we need a sea change, not just some nice words. And we need people in every place that you work, in every organization that you belong to hold people accountable. If you work in a corporation, how many people of color are in management? CEOs of major Fortune 500 companies, there's maybe 5 women and there's 2 Black people. So if you're in one of those companies, how many people on all levels are people of color? And why is that? And then if you're if you're watching television, you should be educating yourself by watching movies where people of color talk about their lives. I love that movie, Little Fires Everywhere, because they show a lot about racial abuse and microaggressions. So I just think if you're a citizen of America, you have benefited particularly from the labor of slaves, whether it be from Jack Daniel whiskey, the recipe coming from a slave, taken from a slave without payment, to mortgages, which were used, the financing of slave property was the predecessor for the development of mortgages, the adoption of Black music, Black culture, Black food. All of that is part and parcel of now American culture that everyone has benefited from. And so we need everyone to rise up and really hold each other accountable so that it's not always on the backs of wonderful people like Martin Luther King, John Lewis, so many people who've lost their lives or spent their lives working on things to make it better in America for people of color.
I really appreciate the fact that you cite the Jack Daniels, the music, all of these other ways in which the Black culture has been, well, to a degree, co-opted.
Co-opted, yeah.
By the culture, the greater culture, and there hasn't been the dominant culture. That's right. And there hasn't been due recognition, due inclusion. And for those of you listening, no, I am in absolutely no way unbiased on this topic, clearly. I really appreciate the way you brought that poignantly forward, Carolyn, and I appreciate you coming and sharing with us today. Is there anything, as we are beginning to close out today, that you would like to put forward around understanding the historical and intergenerational trauma, or around the topic of racial disparity?
Yeah, I mean, I think if you look in your own lives, most people have had, I mean, we know that 2/3 of Americans of all colors have had some kind of adverse childhood experiences. And about 20% have had 4 or more. So trauma is not something that's rare in American culture, sadly. So I think when we start to talk about it being about slavery or about Native Americans, a lot of people just kind of go, you know, because it doesn't apply to me. But when we talk about adverse childhood experiences, 2/3 of Americans have at least one. And so it's important for those 2/3 of you to also recognize that maybe some of the struggles you're going through in your life, whether it be food and body image issues or addiction in your family or depression, anxiety, even cancer, heart disease, diabetes, may have a link back to an intergenerational trauma or trauma, individual trauma. And the sooner you recognize that, the easier it'll be for you to be able to benefit from healing the trauma. So for example, you know, I have the Anchor program, which you mentioned, which is an online non-diet program for people with binge eating, food addiction, and emotional eating. And I have so many patients who come to my program because they've spent their whole lives, some of them starting at age 5, being put on a diet, and then they lose weight, diet, lose weight, gain weight, etc. They've been on that treadmill their whole lives, and some of them are, you know, I've had patients in their 60s, and they're just tired. They want to get off that. They want to stop obsessing about food. And come to find out, the key to getting them off that treadmill is understanding the effect that something that may have happened to them when they were 10 or 12 or 15 has never been addressed. And by addressing those issues, it doesn't mean you have to go back and relive the trauma. It's really not about that. It's about understanding and being educated about how trauma affects the brain, especially of children, and how it changes the hard wiring of the brain. So you may keep thinking, what's wrong with me? I'm successful in all the areas of my life, and yet I'm not successful in dealing with my food and body image issues. Okay, if you understand that trauma changed the hard wiring of the brain, then there's no need for you to feel that something's wrong with you, that you are weak or that you don't have enough willpower. You understand then that all of that started with your trauma. And so what do we do now to help heal that and to change that brain programming so that you don't have to continue your life, you know, on that diet treadmill? And that's like opens up a whole new world for people, that gives them hope that they don't have. I
can imagine.
Yeah.
Yes. And that is, again, that is called the Anchor program. If someone Googled the Anchor program, would they find you, Carolyn?
Yes, you can look either under my name, carolynrossmd.com, or just go to anchorprogram.com. That's ANCHOR program.com.
And I know you said that was about food. Now, I know you also work with people who have other addictions based on this historical and intergenerational trauma. Would they also reach out to you through the Anchor program?
Actually, yes, because there is a contact button there or at my regular website. I have an office in San Diego, and I'm happy to share that, but I also work with people in Colorado and San Diego, but my San Diego office is, I think the phone number is on my website, Carolyn, Carolyn, Ross, MD.com.
Thank you for coming on today and sharing all of this illuminating information, Carolyn.
Thank you so much for having me and allowing me to share my work.
Absolutely. And to all of you listening in, I'm going to challenge you to do one thing every day, whether it is have one short, uncomfortable conversation, whether it is read a book, to educate yourself about the disparities that we are all too often silently complicit in allowing to continue in our country. This is our country. And I know, because I've traveled all around it, there are many, many good people, caring people in this country. So let's stand up, join hands, be together, and make a change. Accept the responsibility that comes with any level of privilege that might have been endowed upon us, whether we wanted it or not. It comes with a responsibility. So let's live that responsibility. Thank you for tuning in today. And I look forward to speaking with you next week.
Thanks for tuning in, everyone. We hope you received inspiration for expanding your own social innovation and influence. Help us inspire others by sharing this episode and leaving your comments over at lesliemichaels.com/podcast. For more tips, insights, and support in creating a fully audacious, professional, and personal lifestyle you love, visit our Women We Should Know community on Facebook.